Welcome to Samba Samba. Enjoy the video.
You start by confirming the edge-to-edge bite. Inspect central incisors in centric occlusion and record with photos and a model. Once done, take a panoramic or cephalometric X-ray to evaluate skeletal relationships and eruption patterns. Make sure to document symptoms, wear, sensitivity, TMJ pain, because they guide urgency. If roots or growth concerns exist, plan for early interdisciplinary input. Begin discussing options with the patient. Simple enameloplasty, an occlusal splint, interceptive orthodontics, or referral to an orthodontist or oral surgeon. You proceed with the chosen corrective mechanics tailored to the cause. For dental anterior-only cases, use braces with light forces to tip incisors back. For deep skeletal cases, plan bite-opening appliances or temporary anchorage devices. Once appliances are placed, apply gradual intrusion or proclination control and use elastics to correct intercuspation. Make sure to monitor periodontal response and root positions on serial radiographs. Check occlusion every 4 to 8 weeks and adjust wires, springs, or TADs to avoid relapse and unwanted tooth movement. You finish by refining the bite. Perform minor enameloplasty or occlusal equilibration to establish stable anterior guidance and canine protection. Once alignment is ideal, fabricate a retainer plan, fixed or removable, customized for growth and compliance. Make sure to educate the patient on nighttime guard use if grinding is present. If relapse, persistent wear, or skeletal discrepancy occurs, reassess for habits, growth, or airway issues and consider referral for orthognathic surgery. Quick troubleshooting. If movement stalls, check appliance fit, oral hygiene, and compliance before changing mechanics.
Thanks for watching. Consider subscribing if we helped you.